I'm Schwahn from Rehab Guru, and I'm going to demonstrate some cupping to the low back. And we're going to use these larger cups, and with cupping, we're going to look to increase the circulation through the area, pull up the fascia, decrease the muscle tightness through the area. So if you have a lot of low back tightness and a lot of low back pain that is muscular in origin, that's where the cupping comes in really helpful. So here we've got a large cup there. We're going to put that on there. We're going to go on to his other low back. And what's nice with this is you can vary the suction. So if you have somebody who's kind of sensitive, you can go light, or you can really create a lot of tension. And then here, I really like to move the cups along the tissue. Or here, if I find an extra tight spot, there is a muscle down here called the quadratus lumborum that goes along the side here, attaches from the low back to the from the ribs down to the pelvis, and that can create really nice tension on that muscle and all the superficial muscles that go in the low back. So we could leave it here, or we could move it around. Here's a demonstration of where we could move it all around. We could come here and we could add another cup. We could, if we wanted to create tension and work on the muscles all the way up the spine, we could come all the way up and all the way down. And there we're not creating any marks. We're just gonna get a nice stretch to the tissue. We'll get a little bit of redness, as you can see here. But again, usually the redness doesn't stay. Sometimes it will, if you leave it on for very long, it will stay for a couple of days, but it always goes away. But you can also do it without making any marks. So it's very versatile. If you've got somebody's got some rib tightness here, or the muscles around the ribs, not the actual rib tightness, but muscles around the ribs, we can go out to the side and get some of even the obliques along the abdominals if you've been doing a lot of working out with your abdominals.